Hello and welcome everybody. Welcome to today's webinar, Calling All Systems Disruptors, Introducing New Resources and Support Leaders to Help Communities Prevent and End Homelessness. We've got four excellent panelists here with us today, and I know they're all excited to share new tools and resources with you. Before we get started, I wanted to introduce myself. My name is Lindsay McCrae. I'm on the communications team at the Canadian Observatory on Homelessness, and I'll be your moderator for today and your contact throughout the webinar if you encounter any tech-related issues. Just a few housekeeping items before we get started. This is a listen-in only webinar, but we do encourage questions, and so if you have any of them, be sure to type them into the question box that you can find in the webinar control panel. If you run into any tech issues throughout the webinar, if you can't hear any of the presenters or anything related to that, also use the question box to connect with me, ask me any questions you have, and I'll try to get back to you as soon as I can. The Q&A session will be held at the end, so we'll be getting to your questions all towards the end of the presentation. Just to let you know, we'll also be recording this webinar and sending a link to the recording to everyone who is part of the audience here today so that you can watch it at a later date or send the recording to anyone who you think may be interested. The recording will also be posted online to the COH Vimeo account and the Away Home website. So lots of opportunities to catch up on anything if you miss it. So now I'm honored to introduce our panelists for today. First is Alina Turner, Principal of Turner Strategies and co-founder and CEO of HelpSeeker. We have Janet Gwilliam, Manager, Engagement and Partnerships Unit on the Homelessness Partnering Strategy. We have Anika Mifsud, Post-Doctoral Fellow at the Canadian Observatory on Homelessness. And we also have David French, Director of Policy and Planning at Away Home Canada. So thanks so much for joining us, everyone here today, and I will pass it on to Alina to take it away.
Awesome, thank you so much, and thanks everybody for joining us today. And as was stated before, we're really excited to present some of the work that we've been busy doing, and some of you out there have already been tapped by us on some of these initiatives. So a pre-thank you to all of you for all your contributions to this work, because it's really not just the Systems Planning Collective doing it. We're really the conveners of community knowledge on systems planning. So thank you for that. Next slide, please. So I'm going to present to you a little bit of background just to set the stage for especially Anika's presentation on our findings to support the SPC actions moving forward. So the Systems Planning Collective and how it works. Effectively, it's a partnership between the Canadian Observatory on Homelessness, Away Home, and Turner Strategies. And our focus has been on highlighting and elevating systems planning work across Canadian communities and to build capacity in communities to support prevention and ending homelessness work from that systems approach lens. So part of our work is to identify and support expertise in communities, and we're going to be talking about a new experts network that's being convened right now. And we're also looking to support actual staff that are doing systems planning work within our shops and within the shops of different community entities and CABs across the country. So next slide, please. And why is there a need? And obviously, if you're on the webinar, you probably feel that there is a need already from your lens. We're seeing that there's excellent work happening in communities, but there isn't necessarily the opportunity to build to that collective intelligence on this work. So we're trying to bring the collective IQ together and put it forward, align it with best practices internationally, and start to connect people to each other. We also want to have a sense of consistency. So what are some of the foundational concepts we want to see across the country, and how do we ensure quality in systems planning work and that high standard of excellence be consistent across the country. We want to encourage communities of practice. Like I said, there's not necessarily a very solid emerging community of practice for systems planners. It's a new way of doing the work that's really emerged in the last 10 years, and we're just now starting to articulate it and how it's different from other concepts like collective impact, for instance. And systems planning is really the technical how-to of collective impact, which tends to be higher level and more convener type. Systems planning is much more technical, and if you've been part of our webinars before, you know we like to get into the very, very nitty-gritty of the work and how it applies to homelessness in particular. We also want to have the opportunity to find and highlight and share innovation in communities around systems planning. So lots of the upcoming webinars will start to elevate some of the less known communities that are doing excellent work in that systems approach and systems integration as well. And we also want to enhance the impact of other efforts in communities. So initiatives like the 20,000 Homes campaigns, collective impact work that might be happening around poverty reduction, etc. So how do all these pieces fit together, and how do we maximize their impact and connect the dots between them? Okay, next slide, please. So how we're wanting to do this: enhancing the understanding, knowledge, and ownership of systems planning within communities working on homelessness, raising the planning IQ. So exactly what does systems planning mean? How do we break it down? What does performance management, quality assurance look like? What is an HMIS? How do you implement, govern, execute HMIS related work? And of course, the training and tools supporting system leaders in their work. And that's why we said calling all system disruptors, because this type of work is often or can be lonely, as well as challenging for leaders that are trying to implement something like this in their local or regional catchment areas. So that community of practice has this double role of a bit of a support group for all of us, and also to convene and integrate our knowledge into consistent tools and intelligence on systems planning. Next slide, please. So the other piece that we wanted to highlight today, and it's a really important initiative and as part of our work, is that we've been able to have a partnership with Reaching Home and start to align our SPC work in support of the Reaching Home priorities as well. And so there's federal investment now to advance evidence-based solutions to homelessness, and that systems planning approach has been made very loud and clear from the national efforts around homelessness advanced by Reaching Home. And so we wanted to support that direction as well through some practical tools and initiatives as well. So there's the three big pieces that we're highlighting today, and you'll start hearing a little bit more about it as the webinar goes on, is that we've had the fortune to have support from HPS funding to advance systems mapping in communities, and that's using the HelpSeeker platform to start actually mapping the services and starting to understand how they integrate into a consistent system of care, so that when you do coordinated access, you actually know where to refer people to and how to refer people to different services, so that they're not stuck in the homeless serving system and you're not bottlenecking. The other piece is the training and resources to enhance capacity of individuals engaging in these system planning activities. And so we'll be talking about some of the modules coming up from this work. And then the launch of a systems planning national experts network. So again, some of you have been tapped already to help us by serving on the expert network. And so we're trying to ensure that we have some geographical representation from across the country, but also to start identifying individuals that are really aligning with this systems planning approach and are advancing that approach in their local communities. So if you haven't been tapped and we don't know about you, then by no means is this an exclusive, one-time only invite club. Let us know, reach out to one of us, and we're happy to have that conversation with you. But that systems planning expert network is going to be really essential in helping us raise that national IQ, identify tools and priorities for new tool development and capacity building initiatives around systems planning. So thank you ahead for those of you who have agreed to be part of this. There's about 20 folks that have been identified and agreed to serve on this network. Okay, next, please. Okay, so systems planning overview, just if you're not familiar with systems planning and what that all entails, and the biggest or the best way of describing is that we're shifting away from the service by service or program by program approach to addressing complex social issues like homelessness, to creating a system of care approach to that. And some people have even challenged us to say, well, the homeless serving system itself, even if you do organize it and everybody's working in the same direction, is never going to end homelessness on its own. So we really need to shift gears to systems integration, and how do we align, child welfare, income assistance, the social housing sector, justice, health, etc., to the goal of preventing and ending homelessness. So an ecosystem approach has been proposed as well as that next level of work. But either way, it's all hinging on this idea of a system of care rather than a program intervention only or haphazard way of building responses. So that's what it means in a kind of just way. But of course, there's lots of research behind it and a lot more details that we can go through. The restructuring of our approach using that housing first or rights-based philosophy is one of the overarching values of our work, and housing first from a philosophy perspective very much aligns with a rights approach to housing and basic needs. So if you're familiar with the United Nations kind of Charter of Rights and the need for basic needs and freedoms, etc. Housing first is really a way of talking about that in relation to housing. So it's not just this program approach, which sometimes it gets confused with. When we talk about it, it's the idea that everyone has the right to housing, and really everyone has the right to much more than housing. But in this context, where housing first is really that rights-based philosophy that we want to apply to the entire system of care and everyone that's working within it. So that leaves lots of room for everyone to come together, including emergency shelters, transitional housing providers, housing first, intensive case management programs, as well as our partners in health or partners in the justice system, etc. So that we all agree that no one should experience homelessness, and we should intervene as quickly as possible to mitigate risk and reduce the time somebody spends in homelessness if they do find themselves in that situation. Next slide, please. So I wanted to also give an update because some of you are participating in the federal pilot on systems mapping using HelpSeeker as well. So we had a goal as part of our HPS work to identify and work with 10 communities that wanted to engage in systems mapping. And again, if you aren't familiar with what systems mapping is, I don't want to say it's an easy thing to do because it's time intensive and all of that, but essentially we have a webinar on it too. If you're interested, we can share that later. It was a previous webinar that we did through SPC, but it involves actually mapping exactly who's doing what in your local ecosystem surrounding homelessness. So it's your immediate players and programs and services that are addressing homelessness, not just what one funder happens to fund, but how they all integrate. So understanding the funding flows in your community around homelessness, how these various big systems intersect on homelessness and who's doing what kind of target populations they have, what kind of eligibility criteria happens to be in place, referral, occupancy, capacity across your system of care. So our federal pilot with these communities, and these are the ones that we've had agreement to be part of the pilot, starting with Vancouver, Abbotsford, Edmonton, Calgary, rural Alberta, Lethbridge, Medicine Hat, Red Deer, Prince Albert, which is Saskatchewan, Winnipeg, Hamilton, Whitehorse, and Newfoundland as a region. These are the communities that we're going to be mapping, and we've already started mapping right now. And we've got a couple more that have expressed interest. So if you are one of the ones that we've talked to already, don't worry that you're not on the list. It just means that we need to have a kind of written confirmation from you to proceed with that. So what we do in this context is we come in and actually map your system for you, and then you can walk away with your systems map as a result of that. So really interesting stuff to start diving into when we have the project finished, and I'm sure we'll come back to share some of our learnings over the next couple of months. All right, next. So handing it over to my colleague Janet from HPS, and she's going to share some of her thoughts on the topic, and I'll hand it over to you, Janet.
Thank you, Alina. That's great. I'm really happy to be here. Thanks for having me. And Employment and Social Development Canada, where we're housed, the Homelessness Partnering Strategy, is very happy to support the System Planning Collective through the Innovative Solutions to Homelessness Funding Stream, which is the national funding stream for HPS. So ISH funding is delivered nationally and supports the development of innovative approaches to reducing homelessness. Funding is used to support activities in 3 key areas: supporting community-based innovative projects to prevent and reduce homelessness and/or the cost of homelessness, building strategic partnerships with key stakeholders, and testing and/or sharing tools, social metrics, and research findings geared towards homelessness. And as you all know, hopefully, Reaching Home, Canada's homelessness strategy, is launching April 1st, 2019. And as we transition towards Reaching Home, we're introducing a new funding stream, which will be the Community Capacity and Innovation Funding Stream. And this will support communities in their implementation of Reaching Home and allow them to foster innovation in the sector. Through this stream, $74 million will be provided over the next 10 years and will be dedicated to supporting training, technical assistance, and innovative projects. Overall, the Government of Canada has committed $2.2 billion over 10 years to tackle homelessness through Reaching Home, reinforcing its community-based approach. Through these significant investments, Reaching Home aims to support communities in achieving significant reductions in homelessness across the country, and we've committed to reducing chronic homelessness by 50% by 2027-28. So Alina has talked about the System Planning Collective, and I just want to talk a little bit about how this is going to relate to Reaching Home's goals. So the SPC is undertaking the groundwork for the development of a systems planning curriculum and the scaling of a systems intelligence tool to assist HPS, designated communities, and others in developing, implementing, and sustaining community-based systems plans to end homelessness, thereby laying the foundation for national reductions in chronic homelessness. And as the conversation around homelessness interventions begins to shift away from managing, that crisis response, we're hoping to concretize a vision for an end to homelessness in Canadian communities. By doing that, systems planning is a whole community process that brings together those multiple players from multiple sectors, touching directly and indirectly on homelessness in order to align efforts and set measurable collective goals for achieving outcomes across a number of indicators of well-being individuals and families beyond housing status. As this project is definitely in line with the objectives and priorities of HPS-ish funding stream to support the development of innovative approaches to prevent and reduce homelessness, it's also helping us provide the building blocks for the adoption of coordinated local homelessness systems throughout Canada. It's a key component of the new Reaching Home strategy. Through the SPC, the Observatory on Homelessness is accomplishing this by responding to communities' needs for capacity building, for broader system coordination, and planning across and within sectors to address homelessness. So I just want to touch on the coordinated access implementation piece. As some of you may have heard, under Reaching Home, implementation of coordinated access will be required for designated communities. So in order to manage this coordination of services, communities will need the support to ensure that they understand their entire homeless serving system, and for some communities, support will be needed in order to engage in effective systems planning efforts from the start if they've not already done so. So what is the SPC project doing, funded by HPS? And the other presenters and Alina started to talk about what these components are, but I just want to go over them quickly. So the first part is designing a community needs assessment, mapping themes and common challenges or areas of needs of concern, as well as community strengths and opportunities to inform the systems planning curriculum phase. And then that's the second component, developing and piloting a system planning curriculum that includes tools to support the community-based approach to ending homelessness. And these will be basic modules that are targeted for communities who have no experience with systems planning, and more advanced modules for communities who have some experience. Finally, there'll be developing and piloting the HelpSeeker system intelligence tool, which Alina already started to discuss, a mobile application allowing increased accessibility of information on programs and services for community members. So the SPC project is going to allow communities to take stock of their current functioning of their service system with a view to identify ways to enhance capacity and improve outcomes. It involves convening players who may or not be the quote-unquote usual suspects of the homeless serving system, but who can or are currently contributing to either perpetuating if they're part of institutions that discharge people into homelessness, but those who are actively involved in the prevention or reduction of homelessness. These players include government officials, policymakers, workers in health, police, justice, child protection, funders, housing developers, etc. So all of these deliverables produced under the project, the 4 training modules, and the refined HelpSeeker.org mobile application will be disseminated nationally in French and English. The materials will be available on the community workspace on homelessness, and SPC representatives will monitor the workspace discussions and provide technical assistance where appropriate. And so now I'm going to hand it over to Anika. Thank you.
Perfect. Thank you, Janet. And first and foremost, thank you so much to everyone here on the webinar for joining us today. We're so excited to share with you not only the findings from the needs assessment surveys that we conducted a few weeks back, but also what our next steps are as the SPC. Slide. So the impetus for the community systems planning needs assessment came from the federal government's new homelessness strategy, Reaching Home, which is launching in April of this year. So Reaching Home requires designated communities to develop systems plans that engage public systems, private sector, and other players that contribute to homelessness prevention and sustained exits. So other public systems could be, for example, physical and mental health, child protection, justice, education, and Indigenous communities. But because many of the designated communities are in different stages of planning, there became a need to take a community-based systems planning knowledge and skills and scale that nationally. So that's where you came in. So next slide. So in order to support communities in setting and reaching their goals for preventing and ending homelessness, we conducted 2 needs assessments. So one was done with CABs and CEs in order to better understand your perspectives on local systems planning that is or about to occur in your community. And the second one was done with housing and social service stakeholders in order to really capture your experiences on the ground, as typically you're the ones that are championing the local efforts outside of CAB and CE members. Next slide. So again, thank you so much if you did participate. We received an overwhelming response from local communities all across Canada. We received 66 surveys from CAB and CE members and 37 surveys from housing and social service stakeholders as well. So what was interesting was that although 88% of the respondents were from designated communities, we found that 11% of respondents indicated that they wanted to apply for designation under Reaching Home. So let's go over what the data found. And I just want to note that while I'm going to provide a really quick overview of what we found, a link to the full report and infographic was sent out earlier today, and it can also be found on the Homeless Hub website. So in theme 1, we found that respondents varied in the status of their planning work. So some were further along, while others were just beginning their work or did not have a dedicated planning group. So a common challenge that was identified by those early on or either further along in their systems planning work was that they didn't have the dedicated funding or staffing resources to continue their work, or they required technical support. In theme 2, we found that communities indicated that they needed more support on how to do the planning work strategically, while also getting buy-in from other sectors, systems, and stakeholders, and how to really track that progress. So for example, 33% of CAB and CE respondents stated that their planning group did not have a shared vision, mission, and guiding principles for their work. In comparison, 44% of housing and social service stakeholders reported that no work plan existed at all. So it's really important to highlight that this demonstrates the key gap that communities have in moving from system planning in their local homelessness sector to more integrated systems planning instead. So in theme 3, we found that while there is a need for systems integration, communities suggested that they needed support in identifying and including the right players in not only the public system, but also those outside the homelessness sector. So 52% suggested that they required some reinvestment in the area of authentic representation of diverse perspectives in order to ensure that all perspectives are supported. So this means that communities understand the need to not only meaningfully include diverse voices, so for example, Indigenous leaders, community members, and those with lived experience, they should be empowered to engage in systems planning work in their own community as well. In theme 4, we really heard that one of the areas that communities require a lot of support on is the use of real-time data in order to facilitate systems mapping, increase accountability, and match clients based on their eligibility. So in fact, 40% of CAB and CE respondents believed that their community did not have real-time data in place. So this is a really significant concern, since communities that don't have a handle on the resources that exist in their community means that there are missed opportunities for clients to receive appropriate resources and support. In comparison, for funders, without that real-time data, they're unable to make appropriate decisions about service gaps at a systems level. So in theme 5, we found that respondents expressed a need for dedicated support for key populations at risk of homelessness. So this could be youth, Indigenous peoples, families, and seniors. So while the emphasis on high acuity and chronic homelessness is critical, we see that communities have a need to create a strategic and targeted systems plan as a cost-effective upstream approach. So in this way, communities can respond to a whole range of populations experiencing an increased risk of homelessness using an immediate and appropriate matching of services and support. So beyond the critical financial and human resources pieces that are crucial for local systems planning work to move forward, respondents also identified a number of priority areas that they require more comprehensive technical support, training, and resources on. And I'll just go through them very quickly from left to right. So for policy development, participants wanted training and resources on how to use systems planning efforts as a catalyst for policy change. For relationship and trust building, participants wanted to learn how to engage with people that are not yet around the table, but also how to ensure that they're enthusiastic and willing to contribute to systems planning work. For performance management, participants wanted tools that would help them determine the health of their systems planning work. For financial scenario modeling, participants wanted to improve their ability to craft specific asks of funders and government, as well as track their progress towards housing and programmatic goals. In comparison, for government relations, participants indicated that they needed strategies on how to engage each order of government in their systems planning work and how to provide them with clear asks and responsibilities. In comparison to the private sector engagement, participants wanted support in leveraging the private sector in order to advance their systems planning work in a way that funds and/or contributes to homelessness prevention. For systems mapping, respondents wanted to have a complete database of programs and services that can be coordinated and leveraged for better planning and accessibility for community members. And for systems integration, participants wanted support on creating that system of care where there is good communication and information flows that puts the client at the center. Actionable data and analytics found that participants wanted to enhance data collection capacity in their community in order to really identify those trends and progress in real time in order to adjust their planning efforts more efficiently. And then finally, for creating action plans, communities wanted to not only break the cycle of creating a community plan that does not inform change or drive action, they specifically wanted to use the plan development process itself as a way to make changes to policy, planning, and practice to improve the outcomes for those experiencing homelessness. So as mentioned earlier, participants had a significant interest in receiving technical support, training, and resources in these specific areas. So the members of the Systems Planning Collective bring many years of experience working one-on-one with communities and governments to hone and refine communities' planning efforts, create and leverage policy and data tools, and impact systems change. So all in all, the data from these needs assessment surveys point to a significant need for to strategically mobilize this collective knowledge that the SPC has in order for communities to have greater uptake and impact. So we really hope as the SPC, we can provide more learning opportunities, technical support, tools, and resources to better position you to be able to fully implement and make progress towards preventing and ending homelessness. And I'd like to pass it on to my colleague, David.
Thank you. I guess this is a good opportunity for me to extend a thank you to ESDC for trusting the SPC with this opportunity to engage community partners and CEs and CBOs. This is that kind of trust building is important, and I think it's an opportunity for not only ESDC but ourselves to look at this work from a new policy lens with this information. And if you weren't engaged in the survey process, so if you're not seeing your feedback here on screen or in the report, we're still keen to understand if these priorities and elements resonate for you. And so if you see alignment here, please reach out to us. If you see gaps here, I think there's still an opportunity for us to understand those and gain some understanding from that. So we don't want to consider the feedback loop closed, but again, it's a start of the conversation. Next slide, please. So, I don't think there's a real surprise in what we heard from communities and their desire to increase and improve engagement with all orders of government. There's the perhaps some frustration there where their engagement with current government officials or bureaucrats or system players, I think their understanding and their awareness of their overall involvement and receptiveness of this work, I think needs to be increased. And either way, we need to have people who are in decision-making seats to be able to be supporting these specific community pieces of work that are needing to shift or change or be tweaked to support the broader vision of system planning. I think there's also a lack of clarity from folks around how exactly government players should be and can be involved in system planning. And so the SPC can help uncover and reveal, sort of peel back that onion around what this means. And we'll continue to offer guidance at the community level to support how to bring relevant government decision makers to the table, and assigning government players at appropriate roles and levels and responsibilities in planning work is key. The results of the survey should be a divining rod for those within government with the ability to and flexibility to participate in system planning. You are the ones who are best positioned to remove barriers, influence decision makers, and blur the lines of policy. And community can only take this innovative work so far, so we need you to be engaged in this space. Next slide, please. What we also heard was that communities want to learn how to link their planning and public systems to various orders of government. So where are the policy levers and windows for them to link this with, as Alina mentioned, poverty reduction strategies, housing strategies, mental health and addiction strategies, early childhood strategies, child intervention strategies. These are all the pieces that are the social fabric of system planning. And so how do we work within those? So the SPC is going to be offering resources, training, and tools to help communities integrate those public systems into their work of preventing and ending homelessness. This means creating system interactions and interfaces with the homeless serving sector. That means aligning efforts that improves flow of data, improves flow of triage systems, but also fulfills the local priorities of HPS and reaching home communities with our federal partners. Any large-scale system work must involve these major public systems that are interacting with the most vulnerable. Provinces and territories take signals, in my experience, from the federal government on this file. So we're eager to take up this fusion policy approach in partnership with the federal government to improve how these systems interact with government. Next slide, please. Communities want to see their work, of course, drive policy change, whether that's community level policy, provincial territorial policy, or federal policy. And so the SPC will draw on government and policy expertise to help communities to better understand and engage in what the policymaking process will look like, and taking those learnings from community and elevating those. And as any good policymaker, I make a confession in that, most of my best ideas weren't mine. And they were based on innovations that were happening at the community and based on conversations and the trust that community had with government to be able to share those innovations. And so working with stakeholders to reach into government for opportunities to innovate and share their innovations will be a significant priority underneath the SPC. I'll pass it back to Alina.
Great. So thank you so much, Dave, for that. I think you should write a memoir on your confessions as a bureaucrat in reform. So, but how much do we appreciate somebody that has, the on-the-ground experience doing policy work? I think it's really valuable. So I think your kind of invitation for other folks in government to be part of this is essential, because we're talking about systems integration, and if we're just doing that by ourselves without our colleagues in government and kind of create these arbitrary divisions between all of us, that we're going to miss the boat, because systems planning is about all of these stakeholders working together. So thank you for that. Next slide, please. I wanted to give you a bit of a preview of what we're currently up to and what's coming your way. And again, this was prioritized looking at the survey as well as what we've been hearing on the ground in our planning work supporting communities over the past several years. So, and again, Janet mentioned this too, that we're developing a curriculum and tools to mobilize systems planning knowledge and support you at the local level to have some practical go-to tools to do your work and to ensure you're successful. We wanted to also let you know that this is available to designated and non-designated communities as well. So just because you're not formally a CE doesn't mean that you can't take advantage of these tools. We're making them freeware, as we like to call them, or as Steve Gates likes to call them. So feel free to share and yeah, send them far and wide to your colleagues, and we'd love your feedback as well on all of these, because they are living documents, living tools as well. Next slide, please. So the pilot modules, and this is part of our HPS Innovative Solutions funding thanks to ESDC, and these are already being developed and are going to be launched with you to you in the coming months. So the first one, and as Janet mentioned, we have some beginner and some advanced modules coming up, and we wanted to tailor these to folks that, you know, when we say systems planning, you might say, what is that? What are you talking about? Then Systems Planning 101 is for you. Or if you have some new folks on your teams that aren't familiar, they come from other sectors and are just new to this work, then again, having that type of a module available that includes kind of e-learning opportunities as well as practical one-pagers or little checklist tools, things that we can package nicely and have as easy to use day-to-day operations tools. That would be part of that. And so Systems Planning 101 will just walk folks through exactly what it is, what the theory is, best practices in this, and highlighting some community work and as examples. The second one is around change management, and we always say innovation, creative disruption, it's really tough work. And if you're not at some point, like we say, crawling in a corner crying because everybody hates you, then you might be doing something wrong. So point being that it's really, really tough work to do this in practice. So hence the need for support in terms of change management, and, you know, what's okay, you know, is resistance okay? How do you handle resistance? How do you move forward with early adapters and that early majority without losing the community in this change process? And so sharing with you some of the trench learnings from this work is part of that second module. And so just so you know what's ahead and what it entails, and to give you also some reassurance that this type of change is tough, and it's tough on the system disruptors as well, and in particular on system disruptors, because they are sometimes spearheading and are the subject to some criticism community as a result. So how do we best handle that, and how can you be supported to do the right thing and bring people with you in the process? Number 3, and very much related, engaging stakeholders. And the reason we call this advanced is because we're going to lean on Dave's expertise in this, in particular in terms of engaging government stakeholders. And around that systems integration, we see consistently that this is where even communities that have done a really good job coordinating the homeless serving system, there's still a lot of support needed in terms of systems integration. So how does the homeless serving network of services and the policy changes that we need to see happen to prevent or stop the flow into homelessness, how does that intersect with government policy and government action on these issues? How do we knit this ecosystem back together around social outcomes? So it's much, much bigger than homelessness. If we're going to move the needle on homelessness, we really are a symptom of much bigger challenges. So how do we actually do this work and engage those critical decision makers to take it to that next level? So this might be something that fits better for those of you that have been at this for a while and see the challenge in terms of integration and engaging those system stakeholders. But of course, I think everybody's welcome to all of these, is just to tell you what we're kind of tailoring it to. And then the fourth one is the governance models. So how do you actually do systems planning governance models, community-based, community-driven, so aligning with some of that collective impact, good practice, but at the same time, you're still having to advance some pretty technical and significant changes in community. So things like coordinated access, that's a part of your role as community entities moving forward, is to advance that type of initiative, or homeless management information systems. and how do you do that within a community collective impact-led approach. So balancing, what the CAB's role is, what the community entity's role is. You might have some other existing table and task forces that are at play. So all of those pieces need to be aligned and moving in the same direction. So we're going to give you some examples of models from different communities that talk about the variations, the pros and cons of different ways of structuring your local governance, and in particular the impacts of that type of a model on your role as a community entity or your role as a community advisory board. Okay, next slide, please. Oh, the question slide, perfect. So yeah, absolutely, we welcome your questions, comments, etc. And I believe we have some coming in.
Hi, we do. It's Lindsay. We do have some questions that have come in, and at this point, we also invite anybody who hasn't yet asked a question to type their question into the question box. We're just going to go through the questions kind of one by one. And so the first question is actually for you, Alina. It's about HelpSeeker, and Roberta S. wants to know how HelpSeeker compares with 211.
Great question. Yeah, great question, because we get this one all the time, and I think it's because people see the front end of HelpSeeker, which is shows you all the resources in a easy to use format. But what they don't usually see is the back end, and the back end is the actual systems map. And so the systems mapping function is actually categorizing all the resources and identifying where funding goes, the analytics, and on real-time occupancy. So knowing exactly, how many spaces do you have in your shelter system, how many interactions have you had with those spaces, etc., and where they fit in the continuum of care. That's stuff on the back end. So thank you for bringing that up, because everybody sees the kind of the front end of the platform, but they don't see the analytics piece. And so that's where it differs. And so on that, what we actually do in communities that have agreed to be part of the pilot, and most communities have some kind of a 2-on-1, or they might have community links or info finders. They have these existing platforms to have a listing of resource directories. What we do is actually work with those partners, including 2-on-1. So for instance, 2-on-1 and Red Deer, we're co-launching HelpSeeker together because we see there's value in the system mapping part. So 2-on-1 handles that front end kind of resource directory piece that I'm sure lots of you are familiar with. What we do is the analytics, data, systems planning piece. And so that's where it differs pretty significantly. The other one is that we work nationally. So our data set is national, and it includes all types of services. So we're not limited to to nonprofit or government. There might be private sector partners that are part of the homeless serving system or the social well-being ecosystem as well. And so we're able to integrate those. And the whole purpose of it is to support system mapping. We're not 2-on-1. We're never going to have a helpline in HelpSeeker. That's not the purpose of it. So I hope that answers it. And if you have any follow-up questions, I'm happy to answer those as well. So if you are a 2-on-1, please reach out to us, because we've had some excellent collaborative initiatives happening with 2-on-1 out in the West. So if there's interest from folks in Ontario or Manitoba, etc., we'd love to collaborate with you on that.
Yeah, Alina, there's actually a couple of follow-ups. People seem to be interested about the HelpSeeker role in this whole process. So Roberta actually just had a quick follow-up about the back end available to CEs. Is that the correct understanding, that the back end is available to CEs and providers of services?
The back end is available to CEs that are part of the pilot. Yes.
Okay. Great. Yes. And then in terms of the pilot, we had a question from Calvin L, wanting to know if by Vancouver being a part of the pilot program, is it Metro Vancouver or just Vancouver as a whole?
Oh, good question. So as of right now, the conversation has been with the city of Vancouver, who wants to use the platform to do system mapping for their homeless serving system, as well as the broader system of care related to social well-being, so things like refugee resettlement, that type of issues that are within their purview. So we are having conversations with Metro Vancouver, but and hopefully they're going to be a 14th region. There's actually 21 municipalities in Metro Vancouver, so it's a big region. But I haven't received the official yes, we want to be part of this, so I can't put it on the list yet.
Great, thanks, Alina. So our next question is a question about the SPC. Is this funded federally? Can you provide some clarification around that?
Yes, it is funded through the Innovative Solutions to Homelessness that Janet referred to earlier. We also kick in resources through our own budgets to come up with some additional in-kind support to get this going. So yeah, it's a combination of, but primarily ESDC funding, yes.
Thanks. So our next question is from John R. And John wants to get a little bit of clarification around the work, the systems planning and management work happening in BC right now.
Oh, maybe that's a Dave question, just because I'm not familiar with what's happening.
Well, and I think the best answer is that from a provincial perspective, it isn't as coordinated as it should be. I know that with the introduction and the expectation of a homelessness action plan in BC, there was a lens towards broader system integration and system planning. But again, that's a future policy response. There are some significant efforts being made in communities that speak to system planning. So I know Victoria and Kelowna and Cranbrook, and there's a couple of others that I think Alina probably has done some work with that are moving towards more refined system planning efforts. And so we can give you examples and connections in those if you're interested in those. But I think from a broad provincial perspective, there's still work to be done there.
Great, thanks, David. So we have a question from Bob Y, and I think this is in reference to the HelpSeeker again, about real-time data.
Yeah.
Yeah, we had another person actually ask about the real-time data. Kat R wants to know about the real-time data and how that information is obtained. And this is something that service providers and agencies need to be maintaining on a regular basis.
So it depends. If you have for instance, if you have a HIFAS system in place, what happens is we can have a plug-in with the HelpSeeker platform so that it can get updated in real time, so that you're not duplicating those efforts. Now, lots of community agencies don't have that type of system in place to enable that level of integration through the technologies, but because you're able to maintain the information, you can update it as you need to or as you want to. So an example would be take the city of Lethbridge. So them wanting to create an integrated response between their addictions recovery system, again, in response to the opioid crisis, and their homeless serving system, and saying, okay, well, we're not able to resolve this community challenge just in one system. We want to bring addictions and health together with homelessness responses. So we want to know in real time what mental health spaces we have in case management programs, what mental health treatment or addictions treatment we have available through private sector providers or government providers or nonprofit providers. And at the same time, we want to know what housing spaces we have to accommodate people and ensure that we're matching mental health addictions needs and services to the client, and maintaining a kind of a real-time record of what we've got going on, so that when we have meetings at coordinated access, we have kind of a real-time data set to work off of, so we're not making referrals to something that's already full. So in that context, their coordinated access policies would say, okay, on, the coordinated access table is meeting on Thursdays at this time, so these key players have to put in their available spaces in the app for that day. So it takes whatever 2 seconds to do that. It's just same as creating a tweet, for instance, where you're saying, here's how many spaces I've got right now. So then those players at coordinated access tables have that information, and they're not having to call everybody at the same time. It's just part of the protocols of the community and integrated into the coordinated access policies. And then you can see how something like that will leverage your coordinated access models, so that they're doing much more than just coordinating your homeless serving system. You're now able to make appropriate referrals and coordinate and integrate with services in mental health and addictions and justice, etc. So that's how that happens. So the answer is, A, you can own the data and manage it yourself as a provider, or 2, you can have a technology kind of a plug-in if you have a advanced enough information system, like HIFIS, for instance.
Great, thank you for that in-depth response, Alina. So now we're going to switch gears a bit. There's a question from Clovis Grant about the relationship between SPC and HPS, and perhaps Janet is a good person to step in to answer this. Clovis is wondering if the SPC is a separate branch as part of the HPS. What's the actual connection to the government there?
Hi, thanks for the question. The connection is that we provide contribution agreement funding to the SPC to undertake this work as part of the Innovative Solutions to Homelessness funding stream. So we have a contribution agreement with the SPC to undertake the activities that I outlined, and that is the relationship. And you can see the Systems Light and Collective is a conglomerate, I guess, a conglomeration of 3 separate organizations who are working together to build great resources and tools and training for communities. So this is part of how we're contributing to that work, and that hopefully that answers your question. Thanks.
Perfect. Thanks, Janet. So we have another question from Roberta. Lots of great questions from Roberta today. In terms of how communities can become part of the pilot program, and specifically what the cost, if any, would be associated with that. And then we also, kind of on the same topic, have a question from somebody who's in the process of developing a youth strategy. This one's from Clovis, and Clovis wants to know how they would get support from the SBC. So sort of a 2-part question there.
Okay. So the pilot, I'm guessing, Roberta, she's referring to the systems mapping piece?
I would assume so. Didn't specifically specify, but if you wanted to speak to that, that would be great.
Sure. So that list of the 13 communities, we had initially targeted having 10, but right now we have 27 on the list of wanting to be part of it. We've said yes to 13. If we've reached out to you and you've shown interest, we're just going to make it happen. But because, and again, we don't want to say no to communities that are really keen on systems mapping, and we want to be supportive of that. So if you are keen on it, just let us know. We just need to get you in the queue because we're a little bit plugged up right now, but it will open up a little bit into May. So what that entails is we actually go in, we have a team of system mappers that go into the community and use open data and our own research to do your system mapping for you. And that's what the government funding is covering, is our actual work to do that kind of grunt work of system mapping and categorizing everything, analyzing the funding sources so that you know exactly who's funding what and how much is going into the community. And so, for instance, like we just finished Hamilton, and their their social ecosystem was about $5 billion per year. But then the actual money going into homelessness was only about a tenth of that. And then what the city funded was, about 11 million of that. So understanding exactly where the money's coming from and where it's going, that is part of the system mapping work as well. And then supporting you to ensure the communities are aware of this work happening as well, and contributing to knowledge. Sometimes everybody's resource directories might be out of date, so we do look at those as a starting point, but they're not live, right? So eligibility criteria, funding criteria, all these things change all the time. So the best way forward is for the community to kind of own the resource and manage the resource. So we do kind of that marketing for to ensure that the system map is a live thing in the community. And so at the end of the pilot, we give you that system map to walk away with and do your planning for. If you wanted that support longer term around real-time analytics, there is a license agreement for that, but the system map work itself is covered by the federal grant, and it would be free to you guys as communities. On the other question about the youth plan and what support we could offer, I think reaching out to any of us, especially Dave and I have done lots of work writing youth strategies on homelessness as well. So we can give you some guidance as part of our kind of technical assistance and our roles as part of the SPC. We also have connections into communities to match you up with other folks that might be at the same stage or just slightly ahead of you if you want to connect with folks doing similar work. We can also guide you through Away Home's expertise area on other communities doing youth related work. Dave, anything else?
Yeah, Clovis, thanks for the question. The SPC work that we can leverage with respect to the work that you're completing in York is going to be really important, actually. And, so we will not only leverage the opportunities that are happening in the SPC, but then also the work that's ongoing with Away Home Canada and our work to support you as a partner with respect to your community planning efforts. So I think you're in really good shape, I guess is what I'm saying. We can continue to talk offline, but yeah, I think we'll leverage all these pieces to support the good work that's happening in York. So thanks.
Excellent. Thank you so much. We have a really important question about the efforts being made to protect and work with Indigenous data and the ownership of that data. Is anyone able to speak on that?
What's the question related to it?
So it doesn't specify. It is from Roberta S. So Roberta, if you're listening and you want to provide a little bit more clarification about what you're specifically referring to, that would be great. But the question is written, what efforts have been made to protect and work with Indigenous data and the ownership of that data?
Mm-hmm, mm-hmm. So as for us, if you're talking about kind of data about Indigenous people, we don't collect data specific to individuals. If the question's more related to the co-creation of resources, et cetera, to support communities, everything that the SBC produces is in the public domain. So it's kind of by community for community. If we work with Indigenous partners, then we would respect the same kind of protocols that are already part of that agreement around shared ownership and of commonly produced information. But I guess I'm not clear on what the question is. Sorry. Dave, did you have anything, or Anika?
I don't have anything, but I think perhaps just some clarity, and we can point the person who asked the question towards what exactly the data collected through HelpSeeker looks like. I think maybe there was some assumptions on the level of data that was being collected, and so we can clarify.
Gotcha. Yeah, so HelpSeeker doesn't collect any data from people. So there's no, it's anonymous data. We don't track, there's no personal data that's collected. So the only data that is in there is about organizational services. So that's from open data. So open government has, open data that's already in the public realm, but it's not about people, right? It's just like, it's open, open data, like about services or charities or, so not individual level.
Yeah.
Right, great teamwork on that question. So we'll move to the next question from Calvin, and it's about municipal government. So how do municipal governments fit into this work, especially if there are municipalities that refuse to acknowledge housing first, and in brackets they wrote NIMBYism, as a viable approach to homelessness?
Dave,
fun.
fun.
This is what excites me. And I think that's the opportunity for us to, and this sort of fits right into that stakeholder engagement advanced module that I'm thinking about and that we're working on, and how do you pull them in, and there's going to be a number of different tools that we can engage and support you on to how to bring those system players in, and you know, unfortunately within a component of that, there's going to be a level of education and bringing them up to speed that's going to be really important. And not saying that you haven't done that already, but there's you know, with a access to data and access to information and best practice and the resources that are already available through the Canadian Observatory, we can design with you a really robust strategy to how to engage and pull them in. And now I'm really interested in what communities, so I'll leave it there. But yeah, you sort of bring up some of the questions that we're seeking to answer with respect to those modules, and how do we equip you with the tools, but then on the other side of the tools, how do we equip you with the support to be able to make those inroads?
Great. And we have another question with regards to municipalities. So Michelle wants to know, how do you see this systems planning work fitting into the community safety and well-being plans that municipalities are now legislated to develop and implement in Ontario?
Ooh, I can take that one too. Dave, you can chime in on it. So that's very interesting about Ontario, because we're seeing the same movement happening in Alberta and BC, as well as Saskatchewan. So, and I'm not sure about the rest of the cities, or municipalities and provinces / territories. But absolutely, this fits in, because the safety and well-being, if you actually break it down, it's got to do with the root causes of poverty, homelessness, things like community safety and addictions, mental health. All of those pieces kind of come together in this kind of new nexus of planning. And those strategies are necessarily integrated systems strategies. So if you think about your homelessness work, it should feed into and inform that higher level of well-being work. And it's exactly what we're talking about when we say we need to knit together the social safety net ecosystem so that we have better outcomes in terms of prevention of homelessness and ending homelessness. That's exactly what we're talking about. So I think it's actually a very good opportunity to infuse the homelessness work and ensure that housing first, rights approach, prevention focus, etc., is front and center in those well-being and safety strategies, because the last thing we want to do is have those strategies kind of propagate some of the same system problems that have contributed to homelessness, right? So you don't want your safety and well-being to say, let's kick out every homeless person because they're posing a safety problem, right? That's the exact opposite. We want that well-being strategy to talk about how we need to address mental health, addictions, homelessness in a comprehensive way, look at prevention and intervention, and knit the fabric together into a consistent system. So if anything, the homeless serving systems work can inform and drive that approach to ensure that it actually creates a coordinated ecosystem around these common root causes and best practices to mitigate homelessness. I'm sure, Dave, you have some ideas on this.
Yeah, thank you for the question. I think it's a really important one, and it almost summarizes the entire piece of work around systems planning, in that, in lots of ways, when a plan or a strategy gets embedded within a certain department, it sometimes gets stuck there. Mm-hmm. And the investments that need to be made across that ecosystem don't end up happening. And so these community safety plans are holistic in their approach. And so they're perfect places for us to identify policy opportunities and windows and levers into other department areas. I'm using my hands a lot. I wish you could see it. Where these priorities that aren't just housing and homelessness priorities need to live and breathe in order for us to move upstream, to move into a prevention space around youth homelessness, but then also move downstream once an individual is housed to prevent future homeless experiences. So yeah, great question. I think there's lots of opportunity for us to weave in these pieces with you and with communities around those. And now is a great time in Ontario with respect to the renewal of 10-year homelessness plans. So I think those kinds of pieces need to be done in tandem.
Mm-hmm.
Wonderful. Thank you for that response. So we'll move to our next question, and it's from Shane P. And this one's a longer one. So this question is potentially for Janet or Alina. Shane writes, when thinking about and working on inflow and outflow of homelessness with regards to system planning, so much of our work seems to be focused on the management of services. With moving from systems to systems planning, are we seeing innovative projects on how to work on root causes such as education, justice, and health, etc., and additionally focus on the outflow to prevent the re-emergence? If so, what are some examples of innovative projects, especially in the rural context?
Ooh, good one. Good one.
That is a good question. Yeah.
Yeah.
Do you want to start, Alina and David, and I can jump in with a couple of ideas at the end?
If you've got ideas already, then go for it. I'm trying to scour my brain for innovative examples without offending anybody else. It's always kind of funny when you pick on people, right? Yeah, Dave or Janet, if you have kind of examples off the top of your head, go for it.
Yeah, well, I think the Making the Shift project that is being undertaken by COH and Away Home Canada is going to be contributing some very interesting findings around preventing youth homelessness from an upstream perspective, and some of that is interventions, and they are school-based interventions. And David, I'm sure you can speak more to this than I can. I'm just thinking off the top of my head. I think the shift to coordinated access is going to help that inflow piece when you have an approach that builds on systems planning, because you're going to be able to better identify and work with the inflow piece, right? And not just being reactive to the inflow. It's being able to target where those inflows are coming from. And I know that in Hamilton and Windsor and Waterloo, there is a distinct shift right now in trying to work with hospitals proactively to look at discharge planning and not doing discharging into homelessness. So I think that there's some, I can't specifically point to, well, this project and this is the name of it, but I think that those are some communities that are really trying to make some inroads on the inflow piece. And under the Innovative Solutions to Homelessness call, the Alberta Rural Development Network is trying to create an innovative, cost-effective model for building affordable housing in rural Canada, and that's a prevention piece as well. So there's work that's being done there. I think there's also some really innovative work that's being done right here in Renfrew County. Terry Lee Kelford is looking at the prevention of youth homelessness in Renfrew County, which is very rural. It's a very rural area. There are no shelters in Renfrew County. So, youth homelessness is hidden, but it definitely exists. And what they are trying to do is prevent youth from leaving Renfrew County and coming into Ottawa, because this is the only place where there are services. The only solution for a young person who was not housed was a bus ticket into Ottawa. That's not acceptable. That's not ending youth homelessness. It's not even preventing it. It's just perpetuating a crisis response. So Terry Lee is really doing some really interesting work here locally around preventing and ending youth homelessness, and then trying to take those learnings in a rural context and broadening them out to adults as well. So that's what I can say about that.
I can chime in too, and I'll draw on two rural communities that might be less known. So one of them is Cardston, Alberta. So tiny, not tiny, but about 5,000 people in southeastern Alberta. And so for them, managing homelessness challenges automatically puts the city in particular, who's the kind of lead system planner there, in a space where they need to talk about poverty, mental health, addiction, social inclusion. And they have the mandate through Government of Alberta. We have a bit of a different structure in Alberta, but similar to the service managers in Ontario, where they have to deal with prevention at the same time as kind of the intervention focus. So there's an opportunity there because of that role of the city as a lead convener in prevention and intervention, that they can start knitting together a systems approach across social issues. So back to the previous question about well-being and safety and community safety, that's what Cardston is working on, is how do they bring together, there's about 100 service providers that might be formal nonprofits, government providers, or informal, so faith community or private sector providers as well. And how do they bring them together around common priorities? And those are primarily prevention related. So things like reducing social exclusion, addressing mental health and addictions challenges, stopping abuse and preventing abuse, etc., and managing housing instability is part of that as well. So for them, it's convening the community together using a kind of that collective impact model, and homelessness prevention is part of that broader effort. And they're connecting the dots between all of those providers. And believe it or not, 100 providers in a community of 5,000, it's, there was a lot that they didn't know that they had. So taking a strength and asset-based approach to the planning effort that means we can do a lot more with what we have, because we know what all is in place as well. And then the other approach that I think is really interesting is Spruce Grove. So Spruce Grove is similarly, the city there has taken the lead in convening community stakeholders to create a well-being, poverty reduction, and homelessness strategy, kind of packaged as one thing. So they automatically talk about how all these pieces come together. So how can we work with schools? How can we work with the health system upstream? How can we identify risk in families and intervene quickly? So things like home visitation programs. Well, that's not just for family well-being, that's also about housing stabilization and homelessness prevention. So people are already starting to go there in their work, because it makes sense, because people are not just their homelessness issues, or they're not just their mental health issues. People have strengths, and we need to treat them and families and communities in a holistic fashion. So it necessarily points us in this root cause prevention direction. I hope that helps.
Yeah, that was great. And David, sorry, did you want to add to that as well?
No, I think I'll leave it there. One confirmation to you, Lindsay. Will our contact information be posted after this? Because I think if the person who asked the question wants to reach out to me, I can sort of plant them with a couple of other examples, but won't fill airtime with them.
Absolutely, yeah. If that's something the panelists would like to be made available to the audience, we can definitely include your contact information in the follow-up email.
Yeah, it's Janet. I'm happy to have my contact info in the file. And also I noticed that there was a question regarding some slides for HPS soon to be reaching home. And while we didn't provide any slides, if you need any additional information or you have questions, feel free to contact me. Thanks.
Excellent, thank you. Yes, there was some questions about more specific details about HelpSeeker, but maybe I'll include, Alina, your information.
Oh yeah, for sure.
Yeah.
I think with all these questions about systems mapping and HelpSeeker, that might be good to do a kind of separate session just on that stuff, and then people can have lots of time and see the back end and what we're doing in 13 early adapter communities and what they're doing with their systems maps as well locally, to kind of have them talk about their own initiatives and within that pilot would be great as a next step for us.
Excellent. So we have about 10 minutes left, so we can get in a couple more questions. There was one question from Clovis that I thought was interesting around confidentiality when plugging into HIFIS, or is that specific to HelpSeeker, or is that something that we want to tackle now?
If it's specific to HIFIS, then it would fall under your FOIP legislation, so that has to be followed. And if it's to do with HelpSeeker, then it falls under PIPEDA, which is a different legislation that's national, unless you're in Ontario or BC, and in which case PIPEDA has like a provincial equivalent. So if you're familiar with that legislation, then that's the short answer, that you have to, or we have to, all adhere to those same legislative parameters around information.
Excellent, thank you. So we have a question about SPC and their work in BC. Is the SPC going to work with BC Housing, VAT, or work independently?
I think we're kind of organization agnostic. We work with anybody who wants support in systems planning, including provincial governments and departments, but community-based organizations, service providers, etc. So yeah, if folks are wanting us to connect with them that are part of BC Housing, we're happy to share knowledge and resources with you and engage you in any of these areas. So by all means, reach out to us. If you're with BC Housing, I wasn't sure.
Great, thank you. So we have a question and sort of comment from Ken H, and it's about seniors. So Ken writes, we've found that the data on homelessness for seniors is greatly lacking. Seniors are very proud and don't think they're homeless when they live with their kids or sleep on couches or move to lower cost zones to find living accommodations. They're on a fixed income. And that's contributing to this. So Ken wants to know, should the surveys be modified to find and identify more seniors?
I can speak to it, and I'm guessing you might be referring to the point in time count surveys, and those tend to for sure underestimate certain populations, because they tend to capture primarily sheltered populations that tend to be adults, kind of working age adults. So seniors and youth and children often get missed, because unless they show up in shelters, and sometimes we have very good reasons, or seniors have very good reasons why they don't feel safe, and similarly with youth in shelter systems. So absolutely, we should be looking at different methods of increasing our understanding of the kind of unstably housed or hidden homeless senior populations. And there's some interesting work being done on hidden homelessness as part of the point in time count methodology to try to get at that exact issue. So, and it's not just, I shouldn't say it's not just those demographics, it's also women or people fleeing violence as well, that we see some underrepresentation and underreporting. So there are ways and strategies that, if you look up at the point in time toolkits, that give some some good examples around how to overcome those challenges. For youth, we can speak to that because we've done lots of work on it. But for seniors, it's interesting because some of the strategies that we've used for to kind of identify hidden homeless youth might not work for seniors. So I think there's kind of more work to be done on how to do that well. And I think there might be some misconception that there are no homeless seniors just because they really are so invisible. The poverty stats are showing that seniors have less poverty than others, but that doesn't mean they're not vulnerable and facing housing instability and other kind of risks and challenges. So if there are good ideas around seniors, we're more than happy to facilitate more dialogue on that through the COH's work on point-in-time count, and that's part of the HPS mandate around point-in-time counts and making that methodology better and better. Long-winded answer, sorry.
No, that's good. I think the more information you share, the better. So that actually wraps up our questions for the day. We have a couple of minutes left, and before we sign off, is there any kind of final words that any of the panelists want to share with the audience?
That's a big thank you for what a great set of questions. I'd say that was the best set of questions we've had in these. So thank you very much for joining us.
Yeah, and I'd like to extend a thanks to Janet actually for finding the time to join us on this. It's a really busy time for the federal government rolling out each home. And so
we're
to
pretty it is a busy time, but this is a really important project, and I think the more I learn about systems planning, the better for me. So it's very sort of selfish on my part. It's an educational experience. But no, I really appreciated being included, and it's just so great to see so much uptake for the work, and it's exciting as we roll out Reaching Home that we're going to be able to support communities with this work. So thank you.
Mm-hmm.
Excellent. Thanks so much. And thanks again to all of our presenters today, Alina Turner, Janet Gwilliam, Anika Mifsud, and David French. And again, thank you to everyone who joined us. Have a wonderful day. Take care, everyone.
Take care,
everybody.
Thank you.
Bye.